Welcome to the June 7th, 2011 Frontline Reports podcast from Doctors Without Borders, Médecins Sans Frontières, or MSF. I'm Sheila Shettle.
The biggest question to governments meeting at the UN AIDS Summit is, now that we know that HIV treatment is also HIV prevention, will you take the necessary steps to both prevent millions of needless deaths, but also prevent millions of needless infections?
This week in New York, heads of state and health ministers from around the world will make decisions that will impact the lives of millions of people. At the UN General Assembly high-level meeting on HIV/AIDS, beginning June 8th, officials are expected to hammer out a blueprint for the next decade of the global response to the epidemic. The meeting takes place exactly 30 years since the discovery of HIV/AIDS and 10 years after HIV/AIDS treatment started in developing countries. It also follows closely on the heels of an immensely important medical finding. Just a few weeks ago, new research supported by the U.S. National Institutes of Health proved conclusively that treatment can reduce the transmission of HIV from one person to another by 96%. In other words, HIV treatment is also HIV prevention. This is something MSF has begun to see in its HIV projects. Having scientific confirmation of this evidence provides a crucial piece of support going forward. That's according to Sharon Ann Lynch, HIV/AIDS policy advisor for MSF's Access campaign.
Now we know that when people are on ARVs, the antiretrovirals that are used to treat HIV, we can also reduce new infections. So in this sense, it is an absolute game changer in terms of mounting a credible AIDS response. So keep in mind that for every person that is put on treatment, that means we can reduce the chance of new infections. For every person that is put on treatment, that person is less likely to develop TB disease because TB preys upon people that have weakened immune system. And obviously for every person that gets put on treatment, on timely treatment, meaning on time, while they're still well, while there's a chance to keep them alive longer, then that's another person who is not going to die needlessly. It's another family that does not need to experience another needless death. It's another community that is not losing another member.
But to get ahead of the wave of new infections and actually start to break the back of the HIV/AIDS epidemic, treatment needs to get to many more people who need it. 6.6 million people receive treatment in developing countries for HIV and AIDS. That's an important accomplishment, but it's not enough because there are another 9 million people who urgently need to start treatment if they are going to survive. This can be accomplished by the international community if there is the will to do so. But for the last 3 years, donor countries have flatlined or reduced their contributions to global HIV/AIDS treatment. Eric Omer, an MSF doctor in Khayelitsha, South Africa, says if countries don't renew their commitment, we will miss the opportunity to continue the incredible progress that has been made in the fight against AIDS.
Yeah, I remember starting as a doctor 10 years ago, treating patients who were extremely sick, and they were brought to us in a wheelbarrow or on stretcher. We saw some of them dying even in the waiting room, and the treatment was too expensive, so we could not treat all of them. We had to choose which one. Only a minority could be treated, and the other one would be left to die. The decision that will be made at the UN meeting in New York will determine the fate of many more who still lack access to treatment. Leaders need to take bold and decisive action. Nothing new there. They need actually to stick to the commitment they made several years ago, which was to provide universal access to all people who dare to test for HIV and are requesting treatment. We are halfway now, and I don't understand why suddenly the political commitment is not there anymore.
Negotiations ahead of the conference have hinted at some promising movements. It appears that countries could soon announce a renewed commitment to putting a substantial number of new patients on antiretrovirals, or ARVs, over the next 5 years. But the struggle does not end there. Governments must also commit to providing the funding needed to meet any new treatment targets. And one of the biggest obstacles to scaling up treatment throughout the developing world is still the price of drugs. Sharon Ann Lynch.
In every country where we work, there is a limit to the number of people who can get onto AIDS treatment. And the question is why? It's simply because of the price of drugs is too high. So the antiretrovirals that are part of the combination cocktail therapy that is given to patients, the drugs are unfortunately still priced out of reach for many governments, and certainly for many poor people. But we know since the beginning of the effort to provide treatment in poor countries that if the right policies are in place, if the right actions are taken, there's no need for the price of drugs to be this high.
A decade ago, it cost $10,000 to treat one person with antiretroviral drugs for 1 year. Today, the cost is roughly $100. This dramatic price drop was possible because more affordable generic versions of these medicines were produced in countries that did not grant patents on medicines. Fierce competition among producers in countries like Brazil, Thailand, and especially India was key to driving prices down.
But that was 10 years ago. And now we're entering a new decade of the AIDS response and new challenges to getting affordable drugs and having access to affordable drugs.
Countries that have produced generics now have to grant patents on newer medicines, which blocks the production of more affordable generics. And trade deals being pushed by developed countries could further restrict generic production.
But the new barriers are in the form of trade provisions and free trade agreements, one under negotiation right now between Europe and India, that would essentially curtail the ability of India to produce generic versions of patented drugs. And this is of great concern, because it's not just MSF, but also at least 80% of drugs being used right now in the treatment of AIDS in poor countries are the generic drugs made in India.
Rich country governments need to stop pushing policies that will restrict the production of more affordable generic medicines, Lynch says. At the same time, developing countries need to exercise their rights under international trade rules to override a patent if it stands in the way of people's access to the medicines they need to stay alive. Despite the new science that treatment is prevention, and despite the excitement that it's generated, there are still some who doubt that massive scale-up of treatment is feasible. Myths and misinformation persist, such as the idea that treatment is not sustainable and that in countries with limited resources, nothing can really be done in the face of an epidemic. But as MSF's experience shows, that is simply not true.
Well, we know from the last 10 years of experience that scaling up treatment is feasible. And we're getting better at it all the time. And when I say we, I don't mean just MSF. Governments are getting better. Aid agencies are getting better. Treatment is being simplified, and also what's needed in order to provide treatment is becoming easier. The easier you make treatment for patients to take, the more likely they are to adhere to it. So lesson number 1 is make treatment as readily available, as close to where people live as possible. Use the existing facilities, use those existing healthcare workers, train them up to provide treatment, and it works. And we have lots of experience to show it.
What MSF hopes will come from this week's UN high-level meeting on HIV/AIDS, says Lynch, is a 2-point pledge.
1, to reach as many people as possible in need of treatment as quickly as possible in order to reduce deaths, illness, and because treatment is prevention, new infections. And then the second point of that pledge that we need to get is that governments will use every means necessary in order to maintain low prices, and that they will not seek to impose or adopt provisions that will place primacy of pharmaceutical profits over public health. It's as simple as that. And for the first time ever, we can really consider a meaningful step towards what could be and what should be the end of AIDS in our lifetime.
Find out more about the UN meeting this week at doctorswithoutborders.org. If you have questions or comments, send an email to msfpodcast@msf.org. MSF, or Doctors Without Borders, is an independent medical humanitarian aid organization that delivers emergency assistance to people affected by wars, epidemics, and natural or man-made disasters in more than 60 countries around the world.